Over the past few months, the world, of course, has witnessed the COVID-19 pandemic, and it's still very active in many parts of the world. What do you think heart failure is an important area to focus on as we are still in the pandemic or in some countries moving out of the worst phase?
COVID-19 has serious implications for older patients and patients with cardiovascular diseases and diabetes and obesity. And these are the exact patients that are high risk of having heart failure. And patients who develop COVID, who have underlying cardiovascular conditions that cause heart failure, are likely to go into heart failure more with COVID being a precipitant. So I think the risk to individuals is higher for these patients and could have really fatal outcomes. Importantly as well, not just in terms of the impact on individuals, but on heart failure communities, COVID has been very disruptive in terms of normal follow-up for other conditions. Patients have the hospital community is very focused on trying to deal with the pandemic. And so routine care has kind of had to take a step back. And so this has implications for heart failure patients, whether they're not being seen as regularly as they should be, their follow-up's being disrupted. They've also had to have greater isolation. These kinds of things also lead to mental health disturbances. So, if you have to isolate because you have an underlying condition, you're elderly, and, we know that depression, for example, patients with depression and heart failure do worse. So the implications on mental health are also important. I think that with COVID specifically, there's a lot of evidence to show that a significant number of patients get a cardiac injury. And we're not really sure what that the sequelae of that cardiac injury and the long-term outcomes of a cardiac injury and chronic lung disease is going to have on our heart failure epidemic in the future. And then just, in terms of one of the questions in the heart failure gap was about sustainability of routine healthcare. Did policymakers think that their healthcare systems were sustainable? And one of the things that COVID has really brought out is that, in times of crisis, are our healthcare systems sustainable? And, are there unaccounted deaths because we haven't been able to maintain the healthcare system as we'd like to? So I think it creates questions around how we can improve healthcare. I think also it's just an important time to address communication with people, and it's an opportunity to say, maybe we need to open communication with patients in different ways now that we're in this pandemic that may be useful in future. Older populations getting heart failure that you might be able to now connect with where because of tools that are being developed through this crisis, like telemedicine and that kind of thing. So while there are a lot of negatives, there are also a lot of positives that can come through this epidemic, and maybe we just need to really learn the lessons.